Could you tell us about what are new advances in cardiothoracic surgery?
Basically, two main advances. One is, like Dr. Lim said, early detection of lung cancer. So only 15% of all lung cancers are early cancers, which can be cured by surgery. Whereas almost 85% of the time they are advanced in stage 3 and stage 4, where they need chemotherapy and radiotherapy. And so since only 15% of patients are amenable for surgery, lung cancer screening is very important in high-risk patients because one, it detects the cancer early and smaller. The advantages of having the cancer detected earlier and smaller is that you don't have to do big operation and you don't have to remove big pieces of lung. Because many patients who have lung cancer are smokers, older patients, and are not very strong. So to remove a big piece of lung is it's not good for the long-term quality of life. So the earlier and smaller you detect lung cancers, you can do a lesser resection or limited resection, or what we call a segmentectomy. Yeah. Just like in breast cancer nowadays, we do not remove the whole breast because the cancers have become smaller and smaller. You just have to remove the lung. Second major advance is, of course, in lung cancer surgery, the old way of doing the surgery is you have to open up the chest. Either you remove the rib or you break the rib, and it's very painful, especially in older patients, those who are smokers, and those who have a lung condition called emphysema. And that is why there's a lot of complications when you do this big operation in this group of patients, and many of them can die or develop complications for the surgery. So to avoid this problem, in the last 10-15 years, people have adopted minimally invasive surgery, or what in layman terms we call keyhole surgery. Just like in abdomen, they call it laparoscopy. In the chest, we call it BATS, thoracoscopy. It can be either done through VATS or it can be done through robots. And basically what it does is does the whole operation through smaller incisions. And why is this good for the patient? Because there's less pain. You do not spread the rib and you do not break the rib. So the patient recovers faster, quicker, and less complications, and they can go back to work early. And not only can they go back to work early, some patients need chemotherapy after surgery, and they can go back and they can start the chemotherapy faster if you can help them cure recovery. The advantages of the keyhole surgery is not only for the patient but also for the surgeon, because